Why doctors should do marketing? This is what we are going to cover in this video. I know once this video is posted, many moral polices will come with their moral compasses and tell, please do not downgrade the noble profession like healthcare. I would like to tell them, sir, we very well know that we are into a noble profession. But when it's a noble profession, it's a business. There are people working with us. We are also human beings. And when we say human beings, we have personal aspirations. We have personal needs. We have personal growth goals. And for that, we'll have to run this business as an entrepreneur. And to run this business as an entrepreneur, we cannot ignore marketing, which is a very vital part of any business. Hello, I'm Dr. Nikhil from Circadian Communications and Analytics, an agency expert in growth hacking for healthcare businesses. As this topic goes, today I'll give you reasons why we doctors should do marketing. But before that, let me tell you, when I say marketing over here, this marketing is not an offer marketing, 30% discount and 40% discount. This marketing is about establishing trust in patients' mind by educating them, informing them, and keeping a good relationship with them over time. Reason number one, if you run a proper educative campaigns to educate your patients, you will start getting good number of prepared patients. Now, what is prepared patient? There are two types of patients. One are blind patients and second are prepared patients. Blind patients are those patients who are coming to you just because someone referred to you or just because they get to know your name somehow. But the prepared patient is the patient who is already your fan and want a treatment or the service only from you. How you can create these prepared patients? By educating them continuously in any form of a content. It can be a written content, the video form of a content. You can use any type of a platform like YouTube, Facebook, or any type of a social media, your website. But once people start consuming your content on, and if you start solving their queries, any form of a query, then people start trusting you. That type of a patient is the prepared patient. And when that type of a patient comes to your OPD, that patient is receptive for any suggestion and any clinical opinion you give. Point number two, distinguishing your specialized practice. And imagine you are a gynecologist and you are specialized in a treatment for azoospermia or oligospermia. But patient is going to treat you as if you are any other gynecologist. Now, how come you can establish your brand as you are specialized in treating azoospermia? By creating content and by creating educational marketing campaigns for patients. Once you establish that, the patients will specifically come to you for azoospermia treatment. Not only that, if that content reach to other general practitioners and gynecologists and other your co-fellow specialists, they'll also refer patients to you. Point number three, establishing a personal brand. I think you and me both will agree. Doctor's personal brand is way more important and way more weighted thing than any hospital's brand or any clinic's name. Right? There is a situation that at least in Maharashtra, hospitals work under the name of big doctors. Why? Because those doctors has established their personal brand year on year. By using all these marketing techniques, especially the educative marketing techniques, you can establish your personal brand. And once you establish your personal brand, there is no end to your growth. Point number four, reducing wrong knowledge on web. Right? So you might be getting Google doctors in your OPD every day in, day out. But it's not their fault. Because it's just a side effect of a liberalization of an internet media. That any person who is not at all authoritative in the clinical domain coming on that internet and publishing the wrong knowledge. And by reading that wrong knowledge, patients are coming to your OPD and doing an arguments with you about their treatment or the course of a treatment. If you want to reduce that, If you want to get into a higher and a dominant side, you have to keep on releasing the good and authentic clinical content. And once you keep on doing that, this will solve all the problems. It will establish your brand, you will get prepared patient, and 3, the greater good is that you will reduce the wrong knowledge on internet. Point number 5, establishing your practice much faster and with a lesser cost. Earlier, what used to happen? Doctor has to work at least for a 15 to 20 years to establish a brand and to reach that stature of a practice. But now, due to liberalization of an internet and the capacity and the ability of internet to reach each and every individual at one click, you can establish that brand at much faster level. And the internet is free, and you can establish that at the lesser cost also. To conclude, I would like to say it is a time that we doctors should accept that we are into business and we are entrepreneurs. And we have to do marketing. And it's our innate responsibility to grow our business. Right? Here I'm not at all promoting any malpractices which are happening into our domain. But yes, being into our own ethical and the moral compass, we should do marketing. If you have any queries, any questions, please do not hesitate to write to me on this mail ID. Thank you and keep watching.